Today's video is going to be taking a look at the difference between a legislation, a policy, and a procedure. So the main differences we see here is that a law or an act or a piece of legislation is something created by Parliament that creates a new law or changes a law that is already in place. Policies, on the other hand, are detailed descriptions of how often a centre or a client should act in order to correspond with the law that's been put in place. And procedures are the written instructions given to staff, and it's kind of the expectations, the things that they should be doing as part of their role in order to meet the policy. So essentially the main difference is the law is what the government says you should do. The policy is how a setting says they are complying with the law and what they expect to be done at the setting. And then the procedure is the way in which staff perform their role and they are complying with the policy. So they're three different kind of things: the idea, the expectation from the government, what the setting says it's going to do, and how the staff are expected to behave. Some of the laws that will come up quite frequently within health and social care that apply to a lot of the materials in the second year unit would be this first two, which is the Health and Safety Act and then the Health and Safety First Aid development of that law. The main health and safety is about trying to keep employees safe, protect clients, visitors, the public, mainly suggesting you carry out risk assessments to reduce the level of accidents. The Health and Safety Edition requires that you have to have appropriate and adequate first aid provision in case of an accident. All accidents should be logged. The Human Rights Act is an older policy. It's quite general to society. It's about giving people equality, fairness, dignity in a range of different areas of life, but it does overlap and come into elements of healthcare. The Data Protection Act in 1998, which was replaced in 2018 by a GDPR, or General Data Protection Regulations. Essentially, it's about keeping information private, confidential, safe and secure, and essentially making sure that any information that is passed between different agencies, different professionals, is accurate and only passed if necessary and securely. The CRB, or Criminal Records Bureau checks, which were introduced in 2002, were replaced in 2012 by the Disclosure and Barring Service, or DBS. Essentially, organisations have to run a background check on anyone working within them, more so to do with people with vulnerable positions or health or education. And generally healthcare settings, most professionals, most people working within them will have this check completed. Every Child Matters was introduced in 2003 following a number of child protection issues such as Victoria Climbié and Baby P. The main element of this is that all children have to have a chance to reach their full potential, reducing levels of ill health, eradicating abuse and neglect. The outcomes are always about staying safe, enjoying healthy, active life, making positive contributions and positive economic well-being. Children's Act kind of develops on from this 2004, providing this duty to cooperate. So all services who concern for a group of people, if they have safeguarding concerns, have to share them, and they can't hold on to that information themselves. RIDDOR, or Reporting of Injuries, Disease and Dangerous Occurrences, again is more about the way that you you're required to record any kind of illness. It's very similar to the sort of first aid, health and safety elements. Equality Act, which comes up a lot, treating everyone equally and fairly. The Lone Worker Policy, which links to professionals who are working on their own within a setting, so it could be going into someone's home, on a ward, and again it's about promoting safety, reducing risk to staff. COSH, which is the Control of Substances Hazardous to Health, is about handling chemicals and biological products. And lastly, provision of equipment. So essentially employers have to provide equipment to staff to ensure they can perform their role safely. Now, how these laws relate to policies means that a lot of them combine together. So if we look at the equality and diversity policy, generally most institutions will have an equality and diversity policy of some name or variation of this name. It's always about keeping and promoting equality in its working. This is influenced by policies like the Human Rights Act and the Equality Act. And when it comes to the procedure of how staff act, they have to undergo training on equality and diversity and agree and confirm they've taken that training. It's often regularly updated. There are punishments in place for anyone who breaks equality and diversity guidelines. There's lots of anti-discriminatory practice being promoted within a setting, and if someone wants to see or witness discriminatory practice, they have to report it. If they see someone acting in a discriminatory way, they have to report that. Another policy would be safeguarding. Safeguarding policies heavily influenced by policies such as the Health and Safety Acts, Children's Act and Equality Act. Ultimately, with all these policies, the idea links to making sure that staff are DBS checked, they're safeguard trained, and they have to have reviews in that. It's about making sure they're looking for signs of abuse and neglect, looking for problems, and obviously if they do spot them, they have to know the processes, who to report to, how, and what needs to be done. The next one we have are health and safety policies. Health and safety policies relate to a lot of different policies on this list. So the health and safety ones, obviously, RIDDOR, lone worker policies, COSH, and PUA. So again, all of these relate to the idea about making sure people are safe within the sector. The main way this is done by staff, the provision or the procedure, of how to do this is through fire training, risk assessments, food hygiene, having cleaning cupboards locked, making sure that any trip hazards are removed, making sure staff have training even on things like lifting patients or how to handle patients. So it's a range of different training to make sure that people, both clients and service providers, are kept safe. The complaints and whistleblowing policy is our next one here. Again, this will be influenced by policies like health and safety, equality, human rights. It's more to do with if you were to see some form of neglect or an issue that you didn't feel was being appropriately handled or a change was being made. It's making sure you know who to complain to, how to make that complaint. Is it informally written? Is it informally mentioned? Is that enough? And who you would go to if your complaint isn't responded to in a set amount of time. And the last policy here is confidentiality policies. So this is always linked to privacy. The policies that would influence us would be data protection or GDPR. GDPR is probably the better one to refer to because that's the most recent policy. Most textbooks refer to data protection because a lot of them were produced in 2016 before the policy was introduced. The way you would maintain confidentiality, the procedures you would use would be, electronic records. If you're passing these on, they're password secured. You're sending the information locked or secured separate from the password. Paper documents are locked away and shredded after a period of time when they're no longer needed. Not having personal information on laptops or phones or devices that could be lost or stolen quite easily. And in terms of confidentiality with data protection, it's also about making sure that information is accurate, is up to date, and so that you're not treating people inaccurately or wrongly because of outdated information. And there we have it. So this is the big differences between the laws, the policies that settings have, and then the procedures of how you would follow that policy or how you're demonstrating that you are complying with the policy and the law. I hope this has helped a little bit with his understanding. Questions occasionally appear asking about a policy or asking about procedures and asking you to identify differences between the two. So hopefully this might be used for that. As always, thanks for watching. Hope this helped, and keep an eye out for future videos.